welcome. Thank you so much for joining us here. I've got two very special guests with me today. One is Kate Yip. Kate is a radiation therapist with Leo Cancer Care who has taught me so much that I've never known about radiation therapy. And our very special guest is Julie McCrossin. Julie is from Adelaide, Australia. She is a former radio and TV broadcaster. She is an MC. She is a Nana. But most importantly, Julie is a 10-year survivor of head and neck cancer. Julie met Kate at Astro this last couple months ago and was excited about our upright radiation therapy treatment positioning system. And that's what we're here to talk about today. So take it away, ladies.
Thank you for that welcome.
Yeah, and it's really nice to see you again, Julie. We met back in San Diego, which was my first trip to the US, really. So it was an amazing experience to be out there.
It was for me too. I have had the chance to go to New York a couple of times and San Francisco, but it was my first time in San Diego, and to meet like thousands of doctors and nurses and allied health professionals, researchers, innovators like yourselves and your company working to improve cancer care. It was a very emotional as well as sort of an intellectually stimulating experience. I should say, for anyone not familiar with this world, I was diagnosed with a head and neck cancer called oropharyngeal cancer. So it's deep, deep, deep down in the throat, such that the lumpy tumor that I had couldn't be seen by looking in the mouth. And it was caused by the human papillomavirus, HPV. And, you know, apart from my interest in your marvelous new technology to enable someone getting radiation therapy to sit up rather than lie down, I had the lying down version. One thing I'd love to say to anyone listening to this is make sure your children get the human papillomavirus HPV vaccination because that's got the capacity to not only prevent cervical cancer, but all the other cancers caused by HPV, including oropharyngeal or throat cancer. So I just wanted to say that because it's just such an important message. But
did you want to talk about the experience that you had 10 years ago in terms of your treatment, and then we could talk a little bit about maybe where Leo is heading in terms of providing an alternative option in an upright position?
Look, absolutely. Look, in a nutshell, I was treated 33 consecutive days in a great big bunker. These are these reinforced rooms where there's a great big radiation therapy machine. They're called a LINAC, a linear accelerator. And you walk in, and I'm laying down on a bench. My feet were put on little holders. I had to lie flat and have my arms holding handles that enable me to keep my arms straight and lined up. And then a big green plastic mask with little holes in it so I can breathe, that had been made in advance to exactly fit my head and upper here, because my cancer was deep down here and I had some little extra bits of cancer as well down here. It clicks you down flat on this flat bed, and it's very tight. They make it tight because during the 33 days, because we lose the capacity to swallow and eat normally, you lose weight. And so they make it really tight so that it'll still work for the full 33 days, because I lost 20 kilograms in 6 weeks, even though I was trying very hard to drink liquid food. And then the radiation therapists, the Kates, very carefully position you in exactly the right position, and you're lying flat, and they sort of talk over the top of you, yelling out numbers. I'll let Kate explain what they were doing. And then they leave the room, and for 20 minutes, in my case, 10 years ago, but I think it's pretty similar now, but for the level of cancer I had stage 4, and there's only 4 stages. This big machine rotates around you, and it sort of made a noise. And that's in a nutshell what it was. And I found that very traumatic. And it's so important for me to say lots of people don't. We've done some research here that indicates approximately 50%, slightly over, of head and neck cancer patients who have to wear that tight mask that restrains you by the head, essentially, just over 50% find it psychologically challenging. And in other words, nearly 50% don't. I've even met people who fall asleep during treatment. So that's really critical. But I was in that group that found it challenging. And indeed, I've come to understand, because I've visited a lot of cancer centers and spoken to a lot of patients, I'd probably put myself in the top 5 to 10% of highly stressed individuals. Mm-hmm. But when I was in San Diego, I was walking around and I saw the Leo Cancer Care chair, is how I'd describe it. And I sat in it, and Kate showed me how I would be positioned. And I was very, very excited because, as I understand it, Leo Cancer Care is focused on the patient experience. And in a nutshell, sitting up, still with the mask on, they've got a board on the back of the chair, the mask would still hold my head steady, and I think I'd still find it a little bit hard. But I think the difference between lying flat and looking up, so people are doing things over the top of you because you can't see that much through the mask. Sitting up, looking, you'd be almost at the same head level as your radiation therapist, and these are the people who administer the treatment, get you into position and administer the treatment prescribed by the doctor. I think you would feel you'd have more agency, you'd have more eye contact. I think the radiation therapist, and I love your thoughts on this, Kate, would be more likely to engage with the patient. I think some radiation therapists are really good at emotional reassurance, and some are totally focused on the system delivery. And that can be to do with the supervision and staffing levels of the cancer centre too, whether you're given permission to take those extra few minutes to reassure us that it's going to be okay. So I'm not actually criticising anyone, because I think it's a system issue. But my radiation therapists weren't very good at reassurance, but they were very good at service, at delivery. But I think if I was sitting up and my hands wouldn't be stretched out on these handles, there's like a little shelf I can put it on. Not only that, you've got a system where I look at a screen and I can help position myself, because your job is to have me in exactly the same position, so you get exactly the beam right on that tumour and you don't do what they call collateral damage, in other words, hurt healthy tissue. And I'll let you describe it, Kate, but because you'll do it better than me, but what I saw was like I could see myself on a screen. And if I was in exactly the right position in my little radiation chair, I was all green. But if I slightly went over that way, it went red. And so I knew to self-correct. This is all in the mask, so it's not like you're doing big movements, but still I could have helped you position myself. And I think I would have felt just that little bit less vulnerable, just that little bit more psychologically secure.
I think you're absolutely right. My clinical role when I was working in a hospital was as a information and support radiographer. So I did do treatment, but I also spent a lot of time one-to-one with patients, and my speciality was with head and neck patients. So I can completely relate to a lot of what you've been talking about how difficult and how much of a struggle it is with the physical side effects of treatment as well as the psychological. We've spent many, many hours with patients just trying to get them in a position where they're comfortable enough to lie down and have their treatment. And there's been patients that never managed it. Their anxiety is just so high that they couldn't have that mask put on their face. They couldn't lie down. They couldn't have it. And they so desperately wanted it. And I think that's something that you see so often in the clinical setting, is that fight within people, that they are so determined to do it. And for a few people, they don't manage it because of that anxiety. But there is that resilience in people, like you said for yourself as well, that you wanted to get through that treatment. And I think for me, joining Leo, I love the technology. I think it's fantastic. But for me as a clinical person, it was always about patient and the patient experience. And luckily my parents are mental health nurses, so it's always been, my background's always been about treating a person, not the disease. And So I wanted to be in a company that has that focus on patient experience. And I know I've spent many hours when patients have been lying down on that bed, holding their hand and giving them a little squeeze just so they know someone is there and someone is connecting with them. And it's just so unfortunate that you haven't got that eye contact. And for me, having you in that upright position, having you on the same level, like when we were at Astro, we were having a conversation whilst one of us was sat in the chair, and it was just a conversation. And there was just so much more connection between us that we wouldn't have had.
I couldn't agree more. And I just want to say, for people who are new to this, radiation therapists like Kate have a very high-tech job to do. You've got to deliver a beam to us from a kind of spaceship control center that's outside the bunker. And for people and you can see us through a camera, but we can't see you. You can hear us, but we can only hear you if you press a button and talk through a microphone. But if I could just come to the physical advantage of the sitting up position, because I know our time is brief, and what you do lose saliva with radiations. Most people get it back, but for some it takes a while. But before it goes, you can get a sort of thick stuff. And again, I'll let Kate explain it, but your mouth, it's a funny mixture of still you've got some liquid and still you've got some thick stuff, because of course you're effectively being burnt inside. And I want to reassure the viewer and listener, we get fantastic opioids and other medication. I didn't experience pain despite this extraordinary treatment, because that's what those drugs are for, cancer treatment. And if you've got a good doctor, you're kept away from pain. But however, when I was lying flat and the radiation had deteriorated my capacity to swallow, which came back, but it took about 8 to 10 months to come back fully. What happens is that fluid, because you're lying flat, and that gluggy stuff, I had a slight drowning sensation. And when it went on, because it's 33 days, by about the 3rd week, I'd lost the capacity to swallow at will when lying flat. That's my memory of it. It was about the 3rd week. And what that meant was, it's a very awful feeling. I learned, it wasn't explained to me, I have to say, but I learned that if I just stayed calm, and by now I did have some Valium in me, the reflex does it and you eventually swallow. Now, why am I telling you this? I've talked to some doctors since I met you in San Diego, and I've been told that if I was sitting up, I would have been able to, that swallowing would have more naturally happened. The other thing I'll quickly say is breathing can be difficult depending on treatment. So if you're having, for example, treatment for lung cancer, you can breathe more easily sitting up than lying down. So that's another advantage. And the other thing, just finally, I'm 69 now. Well, obviously I was in my late 50s when this happened, but I've got quite bad arthritis. So if I lie down on a hard surface, I hurt. It's just because of arthritis and aging. But a lot of cancer patients are old. A lot of us get in our 70s and 80s. So I think sitting up for many will be a more comfortable experience than lying flat. So they're my physical thoughts. But what are your observations, Kate?
Absolutely. And that's the research that we're doing is supporting exactly what you've said, that those thick oral secretions that you get with head and neck cancer treatment, especially in those later weeks of treatment, for some people are really challenging. Some don't get it as much, depending on where we're treating. But then some people have quite extensive surgery, especially to the tongue and the throat. And that swallowing mechanism isn't as efficient as it used to be. And the research is that when you are lying down, even if you're a healthy person, swallowing is more difficult lying down. Whereas in that upright position, it is easier. And when you throw in then all of these difficulties because of surgery and those thick oral secretions, whilst you're in that lying down position, swallowing them like you found is really challenging for a lot of people. And it build up on that anxiety that you get, and because you've got the mask and it is close fitting, like you said, it needs to be to hold you in that fixed position, but it all just builds up and it adds. So what we're saying is that in that upright position, the hope is there that salivary drainage is so much easier because you've got gravity working in your favor in an upright position. So things slide down that bit easier.
But the other thing I wanted to say is, as I said, in my lying flat bunker with the LINAC or linear accelerator radiation machine, this great big thing rotates around your head, and there's various styles, but it's basically the machine's moving. In your system, the beam is steady and the chair very slowly rotates. And the very slowly is important to me because I do get motion sickness, even though, of course, you could have medication for that before you go in if you wanted to avoid the nausea. But I just thought we'd say that that's how the beam is delivered.
Ladies, this has been fabulous. I could listen to you two for hours, but I know our time is short. Julie, thank you for sharing what had to be such a horrendous and just traumatic time in your life, and you're using it to advocate, to help patients. And then with us at Leo, we're fired up about our upright system because we know it's going to make a difference. So Kate, thank you. Thank you. Julie, thank you. Thank you. This has been the most exciting time. Until next time, bye-bye.